Hey guys, it's Nurse Gwenny. Let's talk about abnormal breathing patterns. So how does our body, when we are functioning and in a state of health, decide how fast and how deep it's going to breathe? It's all decided by our medulla. That's kind of our survival cortex there in our brainstem. And how it decides that, it has these chemoreceptors. They're like spiciness detectors that reach out into our blood and look at the hydrogen ion concentration, which tells our medulla what the pH of our blood is. And if the medulla senses a really low pH or acidosis, it's going to tell the lungs, breathe deeper and faster. And you might be thinking of Kussmaul's respirations. Well, think about those patients. They have a super low bicarb, and we need to blow off the CO2 to try to get rid of some of that acid to try to balance the CO2 with that super low bicarb in those diabetic ketoacidosis patients. So what do those patients look like? They're breathing really hard, really deep, really fast to try to get rid of that CO2 as a compensatory mechanism. Think about your brain-injured patients. They might have a crazy breathing pattern like Cheyne-Stokes, or maybe apneustic, where they're and having apneic periods. That's because that medulla has been injured or damaged by that brain injury. So anytime you've got a patient with an abnormal breathing pattern, look for what is causing it, whether it's damage directly to that medulla or the medulla is doing that as a compensatory mechanism for some kind of pathology.